Now we can discuss about the OSCE stations. As you all know, OSCE is the practical section and that has been separated as a different stations. So altogether it is 10 stations. Out of the 10 stations, you are doing APIE first, that is assessment, planning, implementation and evaluation. Then you doing the 4 skill stations, then one from the, that is the writing stations, one from the professional values and another one from the evidence-based practice. So altogether 4 plus 2 writing stations, 4 skill stations, so that will be 6 plus APIE, that is assessment, planning, implementation and evaluation. So total 10 stations. So first we can go through with the APIE. If you start with the assessment station, you complete that APIE, that is assessment, planning, implementation, then evaluation. So all that based on the assessed patient itself. So you doing the assessment for a patient, then you doing the planning for the same patient, then you doing the implementation for the same patient. Implementation is the medication round. After that, you doing the evaluation for that patient. Evaluation is either the handover or the transferring of the patient. In assessment station, you will getting different scenarios. Based on that scenario, you will be doing the assessment of the patient. So there are 12 scenarios. Out of that 12 scenario, any of one scenario you are getting on that day. So you need to prepare for that 12 scenarios, then you are getting on that day whichever accordingly. So each scenario based on the document we are completing and what all the observations we are doing and what all the assessment we are doing. So we will go through one by one. There are based on the different documents you are using on that day. Accordingly we are changing as a news chart or news station, GCS chart or GCS station, MUS chart or MUS station, and the cognitive assessment station, that is 6 CIT score we are doing on there, and also PHQ-9, so patient health questionnaire station. So these are different based on the scenario. For example, if it is an Alzheimer's disease, you will be doing news chart and the cognitive assessment. If it is an anxiety and depression, you will be doing news chart and PHQ-9, the patient health questionnaire. Then if it is an asthma scenario, you will be doing only the news chart. And if it is a chronic heart failure, again you will be doing only news chart. If it is a community assessment, that mainly comes as a malnutrition scenario, then you will be doing the must and the news chart. And if it is an ectopic pregnancy, either you will be doing the news chart only or you will be doing the news and the PHQ-9. That is based on the how the patient mental capacity as well. Again, the end of life, in that scenario, you will be doing the news chart. Hernia, pre and post-op can become, that also you will be doing the news chart. Then fall and fracture. When it's fall and fracture, depends on the whereas, what affected. So if it is a fall and fracture and coronary hip fracture, then you are doing the news chart. If it is a head injury, then it is GCS. Again, the homelessness, that can comes with the news chart. Pneumonia can come with the news chart. And subdural hematoma, it can be comes with the GCS itself. So out of this, any of this scenario you will be getting. So any scenario you're getting, each assessment station is 20 minutes. So you will be completing the patient history, you reading through the patient history, then you completing that assessment station. Altogether, it will be 20 minutes. Then you go into the planning for that patient. Based on that assessed patient, you will be doing the care of planning for that patient. That will be 14 minutes based on that the same assessed patient. 2 care plans you are writing. After that care planning, so planning is a complete writing station. So you will be sitting with under 2 cameras, and you will get all your documents, and they will set the 14 minutes for you. So as soon as you complete that 14 minutes, even though if you not completed your writing, you're supposed to stop your writing. So that is the writing station. Then you're doing the implementation. So implementation is the medication round. So you giving the medication to the patient. So that is the 15 minutes time. So you completing the medication for your assessed patient. After that implementation, you doing the evaluation. So evaluation is a combo of writing and verbalization station. That is only 8 minutes now. So for that, what the documentation you are getting is you supposed to do scribbling for your references. That document is not marking for your exam, but you supposed to, based on that, you need to verbalize the handover to the examiner. So that is the assessment, planning, implementation, and evaluation. Now we will discuss with the skill station. So total 21 skills are there. Out of the 21 skills, you supposed to do 4 skills. So some are coming as a paired skill station. So mostly both paired station will be 20 to 21 minutes. If you are getting wound assessment and ANTT, that will be total 21 minutes. But if you are getting subcutaneous injection and pressure area assessment, then it will be 20 minutes. So we will go through each one separately, and we will go through the each procedure complete separate as well. So I will just go through the timings for each of them. So administration of inhaled medication. So you will be giving the inhaled medication. That is a complete skill station. You all the key points are included in there. So you will have 12 minutes for that. Then administration of suppository, that also all the skill stations are equipments involved. That is 10 minutes. Blood glucose monitoring, that also all the key points and equipments involved. That is 8 minutes. Bowel assessment, that is the writing station. That is 8 minutes. Catheter specimen of urine, that is you are taking the urine sample from the catheter. That is again in the skill station with the equipments and the key points include. That also 8 minutes. Fine bore NG tube, so insertion of nasogastric tube, that also again with the skill with the equipments and the key points included. That is 12 minutes. Fluid balance, so fluid balance is 12 minutes. That is completely right. It's a skill station, but it is a complete writing station. So no key points or no equipments needed. Then we do have hospital resuscitation is 6 minutes, but the key points we don't need to focus on that one because it's an emergency situation. But equipments are needed, but again we don't need to do the arrange articles and those things. We will go through those ones separately. Again, but it's a skill station, so that 6 minutes only. Intramuscular injection, that is IM injection, that is 12 minutes. Again, key points and equipments included. IV flush and VIP score, that also again skill station, that is with the equipments and the key points involved. That also 12 minutes. Nasopharyngeal suctioning, that is 8 minutes. Again, the key points and the equipments involved. Nutritional assessment, that is part of writing station and the verbal station, that is 8 minutes. Oral care plan, that also 8 minutes. Oxygen therapy, again 10 minutes. That is also again with the equipments and the key points involved. Pain assessment, 6 minutes. That is non-equipped but key points involved. Then it's the pain peak flow expiratory, that is PEFR. So that is peak expiratory flow rate. That is, you are checking the lung capacity of the patient. Again, that also equipments involved and the key points involved, that is 8 minutes as well. Again, the pressure area assessment, that is a complete writing station. Removal of urine catheter, that is a skill station with the equipments and the key point involved, that is also 8 minutes. Subcutaneous injection, that is 12 minutes. Again, equipments and key points involved. MSU and urine analysis, so midstream urine collection and the urine analysis, that is also key points and equipments involved, that is 8 minutes. Wound assessment and aseptic non-touch technique, that is ANTT, wound assessment and ANTT, that is if you are getting wound assessment and ANTT, that is a 2 skills combined together and consider as a 2 skills, that altogether it's 21 minutes. So out of this 21 skill station, you will be getting 4 skills. If you are getting wound assessment and identity, that will be altogether it's 2 skills. Then again you do the another 2 skill station as well. I hope you clear this one. Thank you. So now we discussed about the assessment, planning, implementation and evaluation and the skill station. Now 2 writing stations are there. One is professional values and second one is the evidence-based practice. In professional values, there are 15 segments are there. The 15 professional value stations. Out of that 15, any one of them you need to, you will get on that day. And from the evidence-based practice as well, out of 15 evidence-based practice, one of them you will be get on that day. That are 10 minutes for each. So 10 minutes for one professional value, another 10 minutes for one evidence-based practice. So altogether it's 20 minutes. So that is the all complete 10 stations. I hope you all clear about that one. Completely, we gone through complete 10 stations of the OSCE. Thank you.